Care from Crawford Healthcare is a super absorbent dressing consisting of super absorbent polymers and 2 non-adherent layers. It comes in a variety of sizes ranging from 2 inch by 2 inch to 8 by 20 inches. Now let's talk about some features and benefits.
KerraMax Care has 4 features that translate into benefits for you and your patients. First, its heat-sealed border welds the layers together and helps to prevent leakage from the dressing so that the patient remains dry and comfortable. Second, the 2 sides of soft, non-woven material help provide comfort for the patient and allow flexibility so that the dressing can easily contour to different shapes of the body. Having this layer on both sides of the dressing means that you can use the dressing with either side against the wound or stack the dressing if you have an extremely wet wound. Third, the super absorbent core locks in potentially unhealthy exudate, sequestering bacteria and MMPs inside the dressing. Once the exudate is absorbed, the dressing is dry to the touch and helps prevent maceration and peri-wound skin problems. Finally, the unique horizontal wicking layer effectively increases the dressing's absorption capacity by distributing exudate throughout the dressing. This helps reduce the amount of times you have to change the dressing. Many companies talk about the benefit of vertical wicking and how that vertical wicking keeps the moisture away from the peri-wound skin. Unfortunately, what that does is when the fluid is absorbed into one spot, it limits the absorption surface of the dressing. In addition, it can create a pressure point when the dressing is under compression. In contrast, KerraMax Care uses its lateral wicking layer to distribute fluid throughout the dressing so it can utilize more surface area and create a surface where there is no specific gel block or pressure point when it's under compression. By using colored fluid, you can see how the dressing not only horizontally wicks, but also pulls fluid vertically into the dressing and away from the skin. This leaves the soft, outer layers of the dressing dry, helping to avoid peri-wound maceration. The super absorbent core then bonds the exudate to the polymers and prevents it from being squeezed out when your patients roll over onto the dressing or the dressing is under compression. KerraMax Care can be used as a primary or secondary dressing over fillers or silver dressings. Applying KerraMax Care is done much like many other non-adherent dressings. First, you should cleanse the wound according to your facility guidelines. Next, select the appropriate size dressing so that the pad of the dressing overlaps the edge of the wound. You should never cut KerraMax Care. Then, open the dressing pack and lay the dressing onto the wound. Either side of the dressing can be used, and it can be stacked for additional absorption. Finally, cover KerraMax Care with an outer bandage or wrap. KerraMax Care should be changed according to the clinical condition of the wound or when the dressing becomes saturated. As you will see, KerraMax Care is a soft, flexible dressing. There are a few ways you can fold this dressing to address hard-to-dress areas such as the web space between fingers or toes. For this application, use a 4x9 inch dressing. To dress these spaces between fingers or toes, start by folding the dressing in half lengthwise. Now, weave the dressing back and forth between the fingers or toes. You can then use a piece of tape or a wrap to secure the dressing. You now have a way to get good contact in the web spaces. Another place you may want to address is around a tube or a peg site. For this, you're going to use the same 4x9 inch dressing and fold it in half lengthwise. Now, place a finger in the center on the edge and fold one side down. When you do the same with the other side, you create somewhat of a V with the dressing. Now, when you line the edges up, it creates a slot that you can slide the dressing around a tube or a peg. To dress an elbow or a heel, you can use either an 8 by 9 inch or an 8 by 12 inch dressing depending on the size of the patient. Fold the dressing in half like you did in the other applications. This time, you're going to leave a little opening in the V. You then place a piece of tape to hold down the pieces that you have folded over. When you pick it up, you will now be able to separate the layers and open it up, creating a cup. This can now be used on either heels or elbows.